morning at NTV.
Back from NTV there, our man Ivan K. Walnilo speaking to the Mayor Fabrice Rulinda. In studio, we are kick-starting a discussion on medical interns in pre-entry exam dilemma. I have a guest from the Federation of Uganda Medical Interns who will be helping us understand what the latest controversy is and what it means in terms of the way forward. But let's first understand that in 2019, medical interns from Uganda's 5 public universities overwhelmingly protested a decision by the Ministry of Health to set pre-entry exams that will be taken or cert by all medical graduates in order for them to enroll as interns. They also protested the failure to be facilitated by the government as well as the poor working conditions. In the process, they enlisted support as well as opposition in almost equal measure. A renewed wave from government through the Ministry of Health now dives into the process of introducing standardized pre-entry internship exams to all medical interns before they are deployed in hospitals across the country. There's a lot that happens with interns in this nation, and we are not surprised. The latest standoff, of course, is something they are not happy with. But to help us understand this is the Vice President of the Federation of Uganda Medical Interns, Shanitah Nankya. You're welcome to the program.
Thank you so much.
How are you?
I'm okay. How are you?
I'm told it's a dilemma, a controversy, something that again puts you at loggerheads with the Ministry of Health and the government for that matter. What is the problem this time around?
What is the problem?
Yeah.
Our dear viewers, I am Nankya Shanitah. I'm the Vice President of Federation for Uganda Medical Interns. And this is the association that unites us all as medical interns in Uganda. We are not surprised that there has been a rush to bring back the pre-entry exams after the instance of us being home for all that time and, you know, trying to come to terms to Ministry of Health to deploy us such that we can start our medical internship. A medical intern is a doctor, a nurse, a pharmacist, a dentist who has finished their medical degree, and they have to undergo that 1 year or 12 months training under supervision in a hospital, and these are usually government hospitals, PNFPs and others. Yeah. So at that point, when the Permanent Secretary for Ministry of Health clearly stated that they are bringing exams simply because they want to regulate quality, we asked ourselves, why don't they regulate quality when we are starting the university, when we are starting the courses? Previously, you all know there were very few universities that were offering medical education. In fact, you to train as a medical worker, it was a privilege, and you'd know you're the best out of the best. Recently, we have a lot of universities, and their entry points are actually very low, so it does not show the quality that we are training. Most of us trained from the government universities, and we went there by merit, by credit. We do not need to bribe. We did not get those very low points to go into those other universities. So what we want Ministry of Health to do apparently now is to find a way of engaging the different universities and to find a way of regulating at entry. If they have maybe more than 17 institutions that are training these health professionals, how best can they work with the National Council of Higher Education, the Ministry of Education and Sports, to make sure that this is regulated at the start? Because really someone training for 6 years, 5 years, 4 years, and later you tell them they have an exam, and maybe if it doesn't go well, they end up failing the exam, what will happen to them? Do you want to promote people into going for quackery? Because they'll be like, I've spent all my 6 years studying, and here I am. Without the internship, I do not have a license. what next in my life? People will end up going into quackery, which we do not want.
Okay.
Our other point is we want Ministry of Health to not only just come out with policies without engaging the stakeholders. I am not sure if before ministry came up with that policy of the pre-internship exams, really engaged all the relevant stakeholders, including us, the medical interns. We have a body that unites us. We have the executive, and we are very ready and eager to engage with Ministry of Health to make sure that we come up with a clear internship policy that will serve to the best interest of the interns and the local Ugandan down there.
All right. If you just take us through what stage you're at in terms of interfacing with the ministry on this particular issue before it's actually taken on either for debate and for passing in order to become a mainstream policy. Is there any chance that government will back down?
At this point, we do not know if they will really back down. We have not been involved in making of this policy.
Okay.
We are not saying that the policy has been brought in bad faith. We know the ministry is our mother association as well.
Is it part of other aspects in terms of improving or streamlining the health sector, or this is something that is coming as a single entry intervention?
According to them, they are bringing it in a way of improving quality. Improving quality. But to my understanding, personally, I don't think quality is just tested. Quality is made. And that's why we insist that ministry, if they want to regulate the numbers, they want to improve the quality, they should start from where we are training from. We have...
in other words, you're saying doing a pre-entry exam doesn't actually rectify flaws that have been encountered in the process of training. For example, if you have enrolled at, let me for purposes of debate, you've enrolled into the Chris Higenyi School of Medicine. And Chris Higenyi is a businessman who has established one school in the last 2 years, and it has some 50 students who are studying a particular course. And, well, they go through the years, the formative years, but they don't have the facilities, they don't have the necessary personnel in terms of lecturers to do the training and the teaching of these medical personnel. But somehow, somebody passes and then reaches the pre-entry exam and also in a way is able to pass, and then they become qualified doctors only to come and deliver poor services.
Exactly.
That is your fear.
Exactly. That is our greatest fear. It should start from the universities because they are the ones that are training us. In fact, we have a live example apparently. We have colleagues from King Caesar University that trained just like us. The university is accredited by the National Council for Higher Education. It's aware that they are producing doctors. But to our surprise, when these colleagues of us went to the Uganda National Medical and Dental Practitioners Council to register, they were denied the temporary licenses on a basis that their university is not training quality. Why then would you wait for someone to waste their 5 years, 6 years in training, and then only for you to tell them they are not qualified, they are not doctors, they didn't train enough? Yet you could solve this problem right away from the start. These are all wasted resources. These are all wasted resources. It is really not fair for that person, and that's how you are going to see very many people ending up in quackery. Because they studied all that time, they feel like they also need to be given a chance. Medicine is passion to some of us. They also need to be given a chance to do what? To practice. So the very best solution would be the Ministry of Health engages the National Council for Higher Education and the Ministry of Education and Sports to regulate the numbers and provide quality. by ensuring maybe they have a criteria through which they accredit these different universities to train medical professions, just like it used to be before. There are very few universities providing medical education, but now we are over 17. And then you're questioning quality, yet you're the very person accrediting these universities.
Interesting there. I'm constrained because efforts to be able to counter your argument, especially on from the point of view of the Ministry of Health, were futile. We were unable to find a very effective response to somebody to appear to counter this argument. But let's keep on the issue of interns, because that point is clear on as far as the Federation is concerned on what ought to be done in order to ensure the quality standards are maintained to be high. When we look at the other aspects that interns are grappling with, facilitation has been an issue, deployment has been an issue. Recently, the Ministry of Health suggested that some of you could sponsor yourselves if you could. I don't know how far we are on this. Just take us up to speed with the latest developments, or whether you guys have actually been given some of the money that you've been asking for.
Yeah, apparently we were deployed, and we want to thank Ministry for listening to our cry and deploy us. It was really a good one.
Okay.
But because we wanted to serve Ugandans, we did not focus on how much they are paying us.
How much they're paying.
Yes, because our cry was, let us go and serve our people, because they are dying down there in the health facilities.
So right now, how many interns have been deployed?
Over 2,000. There are 2,000.
2,000. You're happy?
We are not very happy.
Is on. Yeah.
We are not very happy. Apparently, we've spent 2 months in our deployment at the facilities, and we are serving the Ugandans out there. I'm very sure most of you have noticed that the healthcare delivery in most of these national referral hospitals has actually improved. Interns are there 24/7 to serve you. But we are also facing a few challenges, and that is, of course, money allowances, accommodation, and the food. Our allowances haven't yet been paid. During our induction previously with the Secretary, with the DG, Director General, Mr. Mwebasa, he promised us that we shall be getting our allowances by the end of this month, September.
Okay.
Yeah, as for me, we tried to follow up on this matter, because we've had colleagues coming out to cry that actually they are not doing well. They are starving. Most of them are about to be chased out of the houses they are renting for accommodation, because maybe probably they paid 2 months expecting some money from the ministry, which hasn't yet come. So we are not doing well financially in our welfare. And it's our humble plea that the Ministry of Health, together with the Ministry of Finance, you try to hasten the processing of our allowances such that we can also survive. We are having interns in the different regions of Uganda, recently the Gulu interns, that are actually being chased out of accommodation. So we really need that allowance as soon as yesterday. All
right, Madam Vice President, I'm afraid, as I was trying to transition slightly from the aspect of the pre-entry exam, and notice came in here that required me to go back just briefly. I'm told that in the United Kingdom there is what is described as the biomedical admissions test, and this one is undertaken as a pre-entry to, well, internship. This makes the odds against you in this particular struggle. This is a tide you cannot stop. The Law Development Center does pre-entry exams for lawyers, and engineering courses at Makerere University also said to be toying with the same idea. So the odds are against you. It's about time that you come around and accept the fact that you will need to do pre-entry exams. Perhaps it's the only way that the ones that are not up to standard will be sieved from the cream.
Personally, I do not think it's the only way. Like I said, Ministry of Health, let them just not come and put things on maybe some of the stakeholders. We know we are part of the stakeholders.
Okay.
So we are very ready, like I said earlier, to engage with them to come up with the best solution possible.
Okay, your last word on this particular issue, or anything else that Chris Higenyi could have omitted, either by, not by design. I was going to simply give myself away. I cannot omit anything by design, but many times there are things that could miss my attention. 1 minute.
Yes, in 1 minute, I would like to say we are sure that the Ministry of Health is bringing this policy to control quality, and maybe in good faith, our humble pleas, let us be involved in the policy making as the medical internship leadership, such that we are aware of what is going on. The next please, we request Ministry of Health, Ministry of Finance, please hear our cry and process our allowances. We are not doing well as per the welfare. Thank you so much. Okay.
According to Shanitah Nankya, the Vice President of the Federation for Uganda Medical Interns Mberambi. The economy is hard, and I know there's something that's going to be worked on. Let's go for a live event. We are ending a little bit earlier than usual. Live event right now. That will do it for this edition of Morning at NTV. On behalf of my colleague Priscilla Regina Naloga, and indeed the team behind the scenes, many thanks. Have yourself a lovely day. We'll see you tomorrow.